4,384 patients die every single day from TB, or tuberculosis. Improper adherence, retreatments, and the selection of drug-resistant strains lead to an estimated $2 billion in wasted spending each year. Unfortunately, these numbers are likely to grow as 1/3 of the world's population carries TB today. All of this despite a cure that's accessible and largely free for patients around the world. So why does anyone still die from this disease? I want to introduce you to Esther, a single mother from Nairobi, Kenya. She walks an hour in each direction to get to the nearest health facility, something the World Health Organization wants her to do every single day for 6 months, forcing a trade-off between going to work or following the protocol. There are side effects to the medication, so Esther feels worse before she feels better and wants to stop treatment, or after a month, she'll feel pretty good and will think she's cured. Esther can't talk about these challenges due to a powerful community stigma that surrounds the disease, and the healthcare system often lacks the resources or the expertise to address the drivers of disease that exist outside of the health facility. Everything is working against these patients. My name is John Rathhauser. I'm the CEO and founder of Keheala, a mobile health company that improves treatment outcomes at lower cost by directly empowering patients with information, motivation, and support all across basic feature phones. Across our USSD and SMS interface, powerful behavioral nudges built into every interaction motivate a patient's adherence to treatment. Public goods messaging, social norms, and increased observability are just a few ways in which we are able to improve adherence. Treatment reminders, disease information, support, and a patient's ability to self-verify their treatment reduces the burden on patients, while healthcare providers can access data and analytics to better focus their limited resources. Ladies and gentlemen, we are the only TB or HIV adherence technology demonstrated to improve health, and we do this independently of the healthcare system. In partnership with the U.S. Agency for International Development, the Kenyan Ministry of Health, and academic partners at MIT, we ran a 1,200-patient randomized controlled trial. Patients using Keheala achieved a 96% treatment success rate. That's above the World Health Organization's goal for 2035, and we did this in 2016. Treating all TB patients in Kenya, we can save over 1,500 lives per year and $24 million in wasted spending by reducing the retreatments, transmission, and selection of drug-resistant strains. Using a simple and scalable software-as-a-service business model, Keheala can be sustained and our impact scaled. Today, we treat 20% of Kenya's annual TB population. The United Nations Development Program hired us for a project in Zimbabwe, and we're working with a telecom to target the private sector. Most recently, our work was published in the top medical journal in the world, the New England Journal of Medicine, and we were covered by the New York Times. There are millions of other patients like Esther who suffer from curable or manageable diseases. With Keheala, we can help provide them the best evidence-based and cost-effective interventions to ensure no one dies from the diseases we've already solved. I look forward to discussing with you innovative ways to sustain and scale Keheala's impact. Thank you.